The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. We hope you had a great weekend and everything is fine. You had a beautiful time today, beautiful weather, and now we can sit back and do some learning. So I hope we can do some talking, and if you have questions, we are live at the WOR studio. We have Noah, who is fantastic, running this show along with Ed. Our number, if you want the direct line to the WOR studio, is 1-800-321-0710. 1-800-321-0710. And he'll put you right through. So again, this is Dr. Lederman from Radiosurgery New York, and the purpose of this show is to provide healthcare news, to answer questions, to talk about cases. Sometimes you might wonder what happened to the next guy or the next woman in the hospital. And we're going to tell you what happened, and we're going to dissect what happened, and we're going to try to make sense of it so you have more sense and hopefully more dollars that you won't spend doing wrong things. So the first case, actually just got a phone call from a doctor who's referring his best friend for consultation. The doctor's a very prominent physician in New York City, and his friend has a melanoma. Melanoma is one of the most aggressive, malignant types of skin cancer. We do treat a lot of skin cancers, by the way, and on sunny days like today, you should remember to put on the sunscreen, even put it on before you go outside. Put on a hat, put on long sleeves, protect yourself from the harmful rays. This man has metastatic melanoma. It's melanoma that has spread to the chest, and he's been getting at a big cancer center immunotherapy to try to slow down the growth of this melanoma. Well, he's had a variety of treatments over time, and the doctor friend called me to say, well, it's grown a little bit. It's gone from 6 centimeters to 8 centimeters. 6 centimeters to 8 centimeters. So is that a little bit or not? What do you think? Well, let's look at it this way. The volume of a container, like if you're going to go to the grocery store and buy peanut butter, there's a height and a width and a girth to that container, or there's a weight, and you can see if 1 pound is $1 and 2 pound is $3, you know it's better to buy 1 pound for $1. Well, this man, we did the multiplication, and by the way, a nodular or spherical cancer is proportional to the radius, which is half of the distance across, the radius, to the third power. So this man's tumor was 6 centimeters. It went to 8 centimeters. Well, that would make it the radius 3. So 3 times 3 times 3 is the radius to the third power. 3 times 3 times 3 is 27. And now it's 8 centimeters, so the radius is 4 by 4 by 4, the radius to the third power. So it's gone from 27 to 48, which means it's nearly doubled. So it's not just a tiny bit. It's been on immunotherapy. He's gone to the famous cancer center. He paid the big bucks, and he had the side effects, and the treatment didn't work. It's that simple. At another case earlier in the week, they said, it grew just by the width of a thumbnail. Well, then I did the multiplication out. We actually had all 3 dimensions in that case, and the cancer grew 300%. So that's why it's so important, if you have cancer or your family member or your friend, to look at the reports. Get the reports. Get them in your hands. We see so commonly, people never get a chance to see their own reports. Why is that? We don't hide anything at Radiosurgery New York. We want you to have your reports. We insist on it. I'll go out and make copies myself. I'll give you the images. I'll give you the scans. I'll give you the reports. You'll have it all, lesion by lesion, because guess why we do it? Well, our success rate is about 90% with radiosurgery, including for melanoma. So this man called me tonight, and he wants to meet. He just called me a few minutes ago. He wants to meet as soon as possible, and we will get him in as soon as possible to meet. And I'll go through all the documents with him, and I'll show him. I've already shown his friend, the doctor, the calculations, but I'll show him how, in fact, the immunotherapy, it didn't hold it stable. The cancer doubled in size. So it's so important to know, what is your treatment doing? Is it working? Is it tolerated? Is it doing something useful for you? Should his whole body be exposed to immunotherapy or chemotherapy if this is the only site? Wouldn't it make sense to do non-invasive treatment, where a patient comes in, gets a treatment called fractionated stereotactic radiosurgery, which is not surgery, it's aiming a beam at the patient, takes 15 minutes, comes in, gets a treatment, and goes back to work, or goes for lunch, or goes shopping, does what the patient wants, not what the doctor wants. Isn't that how you want to live your life? I suspect that is. And if you can avoid surgery or avoid systemic treatment and have great results, I think that's what we're talking about today. And speaking about that, in a recent Wall Street Journal, in an article by Marty McCory, who's a surgeon at Johns Hopkins, he did something very interesting. And what he did was, he looked at patients across America, surgical patients, to see if people were having open surgery. That's where they put a big incision in the patient, let's say to remove your appendix, or to remove your uterus, or to remove your colon or lung. Or do they do it laparoscopically with little pinholes? Well, he looked at 1,000 hospitals, and guess what? The complication rate was less than half. It was 13% in minimally invasive surgeries. The complication rates in open surgeries was 35.8%. Actually, it's almost 3 times higher. And this has been known. It's not new. It's been known. So then he went and he looked at surgeries across America, and what did he find? Well, let's say appendectomies. If you have a burst appendix or appendicitis, 1/3 of hospitals in America use open surgery the majority of the time. So if you go to 1/3 of these hospitals, they'll open you up. They'll put a big incision in your abdomen. 1/3 of the hospitals use a mix of open surgery and laparoscopic, and the other 1/3 uses mainly minimally invasive surgery 90% of the time. Now, the variation cannot be explained by patient complexity because it was related to the hospital, not to the patients. And interestingly enough, 1/3 of U.S. hospitals perform all hysterectomies through open surgery. Now, why would it be that 1/3 of the hospitals use almost all open surgery and 1/3 of the hospitals use almost all minimally invasive surgery? And how does a patient know? And the point of the article is the patient can't know because there's no correlation between doing minimally invasive surgery and the size of the hospital, the affiliation of the hospital, or even the location of the hospital. And he writes, Marty McCrory writes, as a result, a patient has virtually no way of predicting whether a hospital will conduct or even offer minimally invasive option. So why is that? Well, he speculates that it has to do with doctor training, but you're talking about reducing surgical complications, which cost about $25 billion. You're talking about reducing that by more than half. You're talking about getting patients up and around. My daughter, she had an appendectomy, and I took her to the best surgeon I could, and she had an appendectomy at 5 o'clock, and at 7 o'clock she was jumping in bed wanting to get out of the hospital, and she did. A study from Harvard that looked at private insurance database found that surgical complications result in an average hospital payment of $39,000, a cost that's passed on to everybody. So does a hospital win from a complication? Well, they win $39,000 from a complication. So what's the point of this? The point of it is often patients don't know how to get the right treatment. If a third of the hospitals do open and a third of the hospitals do laparoscopic and a third do half and half, how the heck do you know? And I would go one further step. For many diseases, like acoustic neuromas, where we have shown you don't need any surgery, or meningiomas or pituitary tumors, where we can use non-invasive treatment, and if you don't cut open the patient, you don't need to hospitalize the patient, and the chance of infection falls to pretty much zero. And that's what we're talking about on this show, and we're talking to patients every day to learn your options before. Now, you know, at least if you have an appendicitis tonight, to ask the question, is this a hospital that does open and it's going to have complications and a prolonged recovery, or is it going to be laparoscopic, and am I going to be out of bed jumping like my daughter tomorrow? It makes such a difference. Cost make a difference. Recovery make a difference. Complications make a difference. And remember, not everyone recovers from the complications. And this is exactly what we've been trying to point out over many, many years about the potential benefits of stereotactic radiosurgery, which is non-invasive treatment for treatment of tumors in the brain, malignant tumors like metastasis or glioblastomas, benign tumors like meningiomas, acoustic neuromas, pituitary tumors, and in the body. Gil Lederman just published a report showing the success rate for kidney cancer, metastatic to the lung, with radiosurgery, non-invasive treatment is 97%. That's a lot better than getting your chest busted open. 97%. The surgeons can't equal that non-invasively. So if you have a need for cancer treatment, please get your options first. Don't end up in the hospital with complications, infections, pain, when it's very likely you didn't need to. So read this article. It's in the Wall Street Journal by Marty, M-A-K-A-R-Y, physician, the surgeon from Johns Hopkins. He's arguing for minimally invasive surgery, which is great for certain diseases, but there's another step, and that step is totally avoiding surgery. And that's what we're talking about. If you have questions, my name's Dr. Lederman. We're on WOR tonight. We're talking about cancer treatment, how to have a better, safer, happier, healthier life. If you have questions, you can call us at 1-800-321-0710. Noah will take your calls and pass them right through. We're going to stop for just a moment and hear from a couple of new voices about the work we do, and then we'll be right back to talk more.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, First for you with Body Radio